Now, in the fifth and final section of our lecture topic, auricle and tympanic membrane diseases, we talked in detail about the auricle, what are the different benign and malignant tumors, what are the different congenital malformations of the auricle, and now we will talk about the diseases of the tympanic membrane. In this, we will talk about the retracted tympanic membrane. We will talk about meningitis bullosa and herpes zoster oticus. Meningitis granulosa, traumatic rupture and atrophy of tympanic membrane, and then retraction pockets and atelectasis, tympanosclerosis and perforations of the tympanic membrane. Tympanic membrane is the membrane between the external auditory canal and the middle ear. So it's the external auditory canal or the external ear ends at the tympanic membrane, and after the tympanic membrane, the middle ear starts. So it's the tympanic membrane is also known as myringo. So myringitis, tympanitis, these are all the terms used for the tympanic membrane. So tympanic membrane diseases, we have primary and the secondary tympanic membrane diseases. The retracted tympanic membrane. This is the retracted tympanic membrane. If you can see, it is retracted or pushed. The retracted tympanic membrane is usually when the eustachian tube is not functioning properly. It's the tube that connects the middle ear with the throat. So, and it is responsible for the air balance in the ear. So when the tympanic membranes are not functioning properly, the air pressure, the eustachian tube is not functioning properly, the air pressure is less, and as a result of less air pressure, there is retraction of the tympanic membrane. So this is retraction of the tympanic membrane. Meningitis bullosa, a painful condition characterized by formation of hemorrhagic blebs on the tympanic membrane and deep meatus. This is usually caused by Mycoplasma pneumonia. So the bacteria that causes this condition is Mycoplasma pneumoniae, and it is hemorrhagic blebs. So if you see on the tympanic membrane, you can see the hemorrhagic blebs present in the tympanic membrane. Next is the herpes zoster oticus. It's herpes zoster is the viral infection that causes herpes zoster in shingles. So a viral infection involving geniculate ganglion of facial nerve, characterized by appearance of vesicles on tympanic membrane, deep meatus, concha, and retroauricular sulcus. So when there is viral infection caused herpes zoster infection, it involves the facial nerve, and this involvement of the facial nerve is associated with presence of vesicles on the tympanic membrane. These are the vesicles present on the tympanic. Next is the meningitis granulosa. As the name shows, these are the granular tissue is present on the tympanic membrane. These are the granulations present, and it is known as meningitis granulosa. In this, you can see these are the different parts of the tympanic membrane. When you see through the otoscope, to look at the tympanic membrane, this is the light reflex. So this is the light reflex, and then we have the umbo. This is the umbo. This is the handle of the malleus. Malleus is the incus, malleus and stapes are the ossicles or bones present in the middle ear. When you look through the tympanic membrane and when you look the tympanic membrane, you can see these structures of the middle ear also through the tympanic membrane. So this is the handle of the malleus. We have the lateral part of the or lateral process of the malleus. This is the anterior process or anterior part of the malleus. This is the posterior part, anterior and posterior. This is the pars flaccida, and this is the arm of the bone of the incus. This is the long arm of the incus. So these are the different structures, pars flaccida, pars tunica. These are the different structures you can see through the tympanic membrane. And this is the granulation tissue in myringitis granulosa. Next is traumatic rupture. If there is traumatic rupture of the tympanic membrane, usually you see the perforation through the tympanic membrane. And when you do the otoscope or using the otoscope, you can see there is a perforation or hole in the tympanic membrane. So traumatic rupture. Causes is trauma, most likely it's trauma, sudden change in the air pressure, pressure by a fluid column, and there is fracture of the temporal bone. So these are also all the causes of the rupture of the tympanic membrane. Atrophy of the tympanic membrane. There is atrophic tympanic membrane, atrophic, poorly developed, shortness, shrinking, atrophy, shrinking of the tympanic membrane. So this is the pars flaccida, pars tensa, umbo, annulus, cone of light, manubrium of malleus. All these structures you can see on the otoscope. Retraction pockets and atelectasis. Atelectasis is failure of movement, and there is formation of retraction pockets or atelectasis. You can see these are the retraction pockets and atelectasis of the tympanic membrane. Tympanosclerosis. Sclerosis is hardening. So it's the usually this is the tympanosclerosis or hardening of the tympanic membrane. Perforations. These are the perforations visible on otoscope. Perforation. Besides the trauma, one common cause of perforation is increased pressure as a result of otitis media, middle ear infection. When the pressure is more in the ear as a result of accumulation of pus or blood, it can put pressure on the tympanic membrane and cause hole or perforation of the tympanic membrane. Perforations can be central perforation, it can be attic on the top or marginal on the side. So perforations can occur on the different parts of the tympanic membrane. That was all about the abnormalities of the tympanic membrane. Thank you for watching sqadia.com.